Hi, welcome to Nursing Manthra. In today's video, we will guide you through the step-by-step process to become a registered nurse in Australia through AHPRA. Let's get started. AHPRA, which stands for the Australian Health Practitioner Regulation Agency. As a registered nurse looking to get licensed with AHPRA, you will need to follow these steps. Step 1. Self-assessment on the AHPRA portal. You can do a self-assessment on the AHPRA website to determine if you meet the requirements. Step 2. Fee payment. Pay a registration fee of 640 Australian dollars, but always check the official AHPRA website for any fee updates. Step 3. Orientation first phase. Participate in 1 hour online orientation sessions. This session covers the role of a nurse in Australia, job ethics, responsibilities and relevant laws in Australia. Step 4. Portfolio submission. This means collect and upload essential documents. Make sure your documents are attested and provide clear, legible color copies to avoid rejections. Step 5. MCQ exam, that is NCLEX exam. Take the NCLEX exam and pass NCLEX exam. Step 6. OSCE, Objective Structured Clinical Examination. After passing the NCLEX, you will need to attend the Objective Structured Clinical Examination OSCE in Australia to evaluate your practical skills. Step 7. Final registration. Upon successfully completing the OSCE, proceed with your final registration by paying the necessary fees. Step 8. Orientation second phase. Attend the second orientation session within 6 months of your initial registration. Now let us discuss the required documents and fees for this process. Required documents for AHPRA process. Passport copy, passport sized photo with a white background, degree certificate, academic transcript, employment certificate, evidence of any name change. If you have any name change, you can show that. Good standings or certificate of registration status from relevant councils over the past 5 years need at last. Then police clearance certificate covering the last 5 years if needed, that also need at last stage. IELTS or OET, English Proficiency Score report should be there, that also need at last stage of registration process. What is the fees for the process? Initial application fee around 640 Australian dollars. Pearson VUE registration fee 200 USD. NCLEX exam scheduling fee 150 USD. OSCE fee around 4,000 Australian dollars. Final registration fee 489 Australian dollars. Additional fees to consider include your nursing council verification or good standing fee, police clearance fees, notary attestation, IELTS or OET exam fee. So don't forget to budget for visa charges, airfare, accommodation and living expenses once you arrive in Australia. This is all about the fee structures. Regarding AHPRA, Nursing and Midwifery Board, there are 3 streams to consider. Stream A typically include candidates who studied nursing in countries like UK, Australia and the USA. So exempting them from NCLEX and OSCE. So those people will come under Stream A. Stream B means applies to candidates from countries such as India, Nepal, Philippines and other countries requiring NCLEX and OSCE. That will come under Stream B. Stream C means pertains to diploma candidate who must complete additional courses in Australia to meet Australian standards. Approved program lists are available on the AHPRA website. So those who completed the diploma in nursing, they have to go under Stream C category. They have to attend some of the courses in Australia to meet the Australian standards to become the registered nurse. The course details, approved program list, it is AHPRA website, you can see. The registration for registered nurse is for who completed bachelor degree in nursing. For diploma in general nursing candidates, AHPRA will assess your application and recommend some courses to attend to meet up with the Australian curriculum standards. it will cost you more. So currently, those who completed post BSN or MSN, then BSN can apply for the process in easier way. Now we will discuss how to do the application. Start by commencing the self-check and enter your details, selecting registered nurse as your profession category. Make the required payment of 640 Australian dollars on the IQN site. Then attend the orientation part 1, which involves watching 1 hour video classes on AHPRA healthcare system responsibilities and more. You can complete this class even if you cannot attend it all at once. When preparing your portfolio, scan your educational certificates and transcripts in color copy. Ensure you follow attestation guidelines and note that for Indian applicants, the notary attestation is sufficient. Once your documents are uploaded, AHPRA will guide you to the next stage, which is the MCQ exam, NCLEX exam. The duration may vary, but typically takes around 2.5 months like that. So after receiving your MCQ exam eligibility, that is NCLEX exam eligibility, you must register on the Pearson VUE platform. And you have to pay 200 USD as the registration fees. So within 45 business days, you will receive an ATT, that means authorization to test, allowing you to schedule your NCLEX exam. Keep in mind that you have 3-month time frame to complete the exam once you receive the ATT. Results are typically available within 6 weeks. If you pass, you will proceed to the OSCE, which stands for Objective Structured Clinical Examination. The OSCE is conducted at the Adelaide Health Simulation AHS in Adelaide, South Australia it is. The fee for the OSCE is 4,000 Australian dollars per sitting. But only make this payment if you are currently in Australia. For offshore applicants, it is advisable to consider visa processing details and border openings before making the payment. When applying for a visa, aim for a longer duration visit visa, preferably 12 months like that, even though the actual duration may vary. You can use your OSCE eligibility letter when applying for visit visa to enter Australia. OSCE exam slots are limited, so be vigilant about emails with exam schedules. Respond quickly as slots are allocated on a first come, first served basis. So you have to prepare for the OSCE as early as possible. Practice is key and you can find various online resources including OSCE exam models and videos. OSCE exam consists of 10 stations and each station lasting 10 minutes for a total of 100 minutes. You will have 2 minutes to review the scenario and 8 minutes to perform the task. Clear therapeutic communication and documentation are crucial here. Consider actors or mannequins as real patients and review the Nursing Council standards for registered nurses. If an emergency prevents you from attending the OSCE, you have to notify the IQN exam team at least 3 working days before for rescheduling, or you will lose the fees which you have paid. Results are usually available within 8 weeks. After passing, continue with the registration process. In case of a fail, you will need to pay the full registration fees again and wait at least 1 month. Next, you will enter the registration process. You must have an English proficiency test, either IELTS or OET, with a specific score requirement. IELTS requires an overall score of 7, while OET requires an overall score of B in all modules. You can achieve this score in 1 sitting or 2 sittings within a 6-month time frame. You will need the following. Need to provide a certificate of registration, COR, or certificate of good standing, COG, from previous registrations over the past 5 years. These certificates must be sent directly to AHPRA from the respective authorities. You will also require a police clearance certificate for the past 5 years. Attest your course certificate, like a degree certificate, academic transcript, evidence of any name change, passport, photo and employment details from the past 5 years. You have to attest it. Upload clear and attested copies of these documents and pay the registration fees, which include the application fee of 309 Australian dollars and a registration fee of 180 Australian dollars. So total it will come 489 Australian dollars. Together you have to pay this amount. You can track your application status on the dashboard, which includes stages like application received, assessment, awaiting further information, awaiting board decision, present in person and decision like that. So congratulations, your registration certificate or license will be available in your dashboard. Don't forget to complete the second oration within 6 months. After obtaining your registration certificate or license, you can start searching for nursing jobs in Australia. If you need assistance for license application throughout the entire process, including your OET and NCLEX study materials and application process assistance, feel free to contact Nursing Manthra WhatsApp. We hope this video has been helpful for a registered nurse looking to quick start their careers in Australia. Thank you so much for watching. Please subscribe and enable the notification bell to get the updated videos about various topics related to the health